Hi, hello, welcome back. So, you're watching Learn with Danya. So, today we are into a new topic and last topic of ICD-10 CM guidelines, chapter 18, that is Signs and Symptoms, code series R00-R99. So, if you are watching my channel for the first time, I have added a few guidelines playlist. You can watch it in ICD-10 CM 2025 guidelines. So first guideline is patient coming to the hospital with symptoms and doctor finding out a diagnosis. So here he is coming with a symptom and doctor is finding out a diagnosis. You have to code only for the diagnosis, don't code symptom. Second guideline, patient coming with symptom and doctor is unable to find out a diagnosis. In this case, we should code for all the symptoms. Third guideline, patient coming with symptoms, doctor is finding out a diagnosis and there is an unrelated symptom. First code for diagnosis, second code for unrelated symptom. The next guideline is repeated fall. In case if it is mentioned like repeated fall, first code should be coded for repeated fall R29.6 and second code should be given for history of falling, that is Z91.81. Next guideline is coma. So if a patient diagnosis is mentioned like the patient is said to be in coma, the primary code will be coded for unspecified coma, that is R40.20. Here one thing you should make it very clear, should be assigned when the underlying cause of coma is not known or the cause is a traumatic brain injury and the coma scale is not documented. In that case, you will be coding it as unspecified coma. Next is coma scale. The coma scale code is R40.21 to R40.24 and it is always coded along with the brain injury codes. So whenever a patient is brought to the hospital with brain injury and Glasgow coma scale is being used for the patient, first code for brain injury and second code for Glasgow coma scale. Next guideline is SIRS due to non-infectious process. So non-infectious process includes trauma, malignant neoplasm or pancreatitis. So SIRS is systemic inflammatory response syndrome. When SIRS is due to non-infectious process, first we have to code for non-infectious process, second code for SIRS with or without organ dysfunction. That is R65.11 for with organ dysfunction and R65.10 for without organ dysfunction. If the patient is brought dead to the hospital, directly you will be coding R99 as the primary code. That is unknown cause of mortality and the main reason for admission is death. Next comes NIHSS stroke scale. NIHSS stroke scale is National Institute of Health stroke scale, mainly used to measure the severity of the stroke. So primary code will be for stroke, that is I60 to I63, and if the NIHSS stroke scale is used, second code for NIHSS, that is R29.7. Again I will confirm this is used to measure the severity of the stroke. So that's all about chapter 18. It's a very simple guideline and easy to understand also. Make sure you are taking note of all the guidelines so that it will be easy for you to prepare for your CPC exam as well as for your interview. Thank you so much for watching. If you are watching my channel for the first time, please do subscribe, and if you find it useful, share it with your friends also. Thank you so much. Thank you for your time. Take care. Bye-bye.